Hi guys, I'm Dr. Carolyn Zeiker. I'm a pediatric physical therapist here in Austin, Texas, and I'm the owner of Boost Babies. I want to welcome you guys to our second family health support meeting. The purpose of these meetings is to create a space where parents can receive community education and support directly from healthcare providers. So we're shooting for about 30 minutes on this meeting, and with that I want to welcome our special guest host, Emily Blewett. She's a certified lactation counselor and NICU nurse, as well as owner of Infant Basics and Toddler Training. Hi, Emily.
Hi.
So today we're going to be tackling topics including reflux, flathead prevention, crawling muscle development, breastfeeding, baby food, swaddle guidelines and tips, and caregiver support. So we'll start off by addressing some common questions surrounding these topics that we got from the community, and then we'll open up the discussion to y'all. Just so you know, your computers are muted. Please keep them muted unless you're asking a question or sharing, okay? So I'm going to start off today, and we're going to tackle the big topic of reflux. So with reflux, this is a very common term that doesn't necessarily mean it's a pathology. So this is when the stomach acid actually flows back up from the stomach into the esophagus, which is the tube that connects the mouth to the stomach. The actual reflux disease, or GERD, is when this becomes a pathology. So this can be more serious, it's longer lasting, and it's when the actual stomach acid damages the lining of the esophagus. So with that, I wanted to say that 50% of infants spit up many times during their first 3 months, and that does not mean it's a pathology. 2/3 of all 4-month-olds show signs and symptoms consistent with reflux disease. And by 12 to 14 months, 10% of all infants can show symptoms of reflux disease. So again, that doesn't mean that they have the diagnosis of the disease. I just want to emphasize that it's very common for infants to spit up, and it's also very common for infants to show symptoms that can relate to a pathology. Okay, so with that said, because reflux is so common, there's a lot of information out there on the web, and a lot of it is not based on scientific evidence. So I really wanted to show you guys and share with you guys a few tips that I know that is absolutely founded in the clinical research. So number one, we know that infants show the biggest decrease in reflux, or the least amount of reflux, while they're sleeping. So we know that sleep decreases the stress hormones, and that if we promote good sleep, we can improve reflux. Emily's going to talk later about swaddling, and swaddling can be a really great tool to help decrease reflux. Another thing that I want to talk about is positioning. So based on where the stomach is in the body can also affect the severity of the reflux. So in very young babies, less than 2 months of age, supported sitting is one of the worst and most stressful positions that they can be in. This is because they have poor postural control, and that can increase their reflux. We also know that in sitting that the liquid in the stomach gets closer to the sphincter that's between the esophagus and the stomach, and that can put more pressure and increase that reflux. A position that actually helps decrease reflux is prone positioning, or on the tummy. And so I like to teach parents what I call the colic hold. And that's when you place the baby on the crux of your forearm like this, or it's like a football carry, and you can walk around, you can hold them on their chest. And this is a really great position for babies because it actually lifts up that junction between the esophagus and the stomach, creating more air and less liquid there, so it decreases the amount of reflux. Another position to be aware of is side lying. So if your baby is on their left side, they do better than on the right side with concerning to reflux. Again, it's all based on stomach anatomy. When they're on the left side, they have more gas near that sphincter and less acidic liquid, and so therefore it decreases that reflux. Also, when the babies are on their left side, their digestion time almost doubles. Therefore, they have less acid in their stomach, and therefore decreases that reflux. So we also know that the more time there is after a feed, the more acid there is in the stomach. So another suggestion is that if you do smaller, more frequent feeds, there's less acidity in the stomach. Okay. I do want to emphasize that if your child is spitting up and it's affecting their weight gain, it's affecting their actual feeding, they're unable to feed, you feel like it's causing increased pain and they're crying a lot, please talk to your physician about this, okay? And Emily, I'm gonna throw it over to you to add your tips about reflux.
Awesome. So I'm going to just go over the anatomy and why babies spit up. So what happens is we have our esophagus, which is our feeding tube, and then the end of the esophagus is the esophageal sphincter, and that's a circular muscle that opens and closes at the end of the esophagus, right there before this, right there by the stomach, and that doesn't fully develop until about 4 months of age, and so that's why a lot of babies spit up. Some spit up more than others, but if they're happy and gaining weight, then there's no need to worry about them spitting up. But the ones that we're worried about are the ones who are unhappy. So signs and symptoms of reflux would be no weight gain, very slow weight gain, inconsolable during and after feedings, arching their back, extreme fussiness, inability to calm. Those would be some of the signs and symptoms to look for if your baby has reflux. Ways to help babies, really these are ways to help all babies, whether your baby has reflux or not, first is once your baby's 2 weeks of age and older, they're healthy, they're gaining weight, we want to follow the Moms on Call schedule appropriate to their age. This makes early digestion as easy and natural as possible. It works with the way the body is just makes it more predictable for them. Because we like to do bulk feeding, digest, rest, reset. Because this gives their tummy and digestive tract time to rest, reset, and boost. Because if we're constantly doing little cluster feedings and letting feedings go over 30 minutes and last an hour, every time formula or breast milk touches their stomach, then the GI juices and acidity start to build up, and the acidity is what causes the pain for babies with reflux. So if you can get your baby on a good, predictable feeding routine, all my babies with reflux tremendously increase their intake with feedings. And if we can get them to increase their feeding intake during the day, then they're going to be able to sleep well at night. That is my first always puzzle piece that I tell families who have babies with reflux. Others is for bottle feeding. If you're bottle feeding them, we really like to use the old-fashioned nipples. So my favorite bottles are the Gerber bottles you can use it with I actually like to use Dr. Brown nipples with the Gerber bottles. These are really cheap to find on Amazon. You can even probably find them at your local grocery store. Or if your baby's just really having a hard time with eating or latching, my other favorite nipple is infant milk, which they're made for the hospital. So they're disposable, but you can actually wash them and use them about 15 to 20 times. But this is with the yellow nipple, it's a little bit more firmer, so it helps them get a better latch. But I would always try these first just because these you have to keep replacing, and the Dr. Brown nipples last longer. We also want to keep feedings under 30 minutes because feeding is like an aerobic exercise for babies. So when feedings go over 30 minutes, they end up burning more calories than they can take in. And also another thing to help is not taking them off and on the bottle or their breast to burp them a lot, because the initial suck on the breast or the bottle is the one that produces the most air intake, so then that will cause more gassiness and fussiness. And then if your baby's under 4 months of age, I like feeding in the sideline position, so you just put them in your lap, but I have a little higher so I can show you. We'll just have the baby in our lap, bottom against yours, and you're just supporting them like this, and we're doing the sideline position. And what this does, instead of the crook of the arm, is this just lets gravity do all the work, and they're not able to control or pace themselves. It can make them have a negative association with the bottle as well. Another reason why we like to do side lying, because it mimics breastfeeding. It shows babies when we do this, they have more endurance. So they actually are more involved in the eating during the bottle feeding, more awake, more alert, and also increase their volume when doing that side lying position. The other thing is white noise machine when they're sleeping for naps and nighttime sleep. This really provides comfort and relaxation to all babies. And my favorite is the hatch or the electrofan. Another thing is for babies under 3 months is if they're sleeping in their crib or bassinet, we want to swaddle them. Like Carolyn talked about, this is so relaxes their body instantly, and when they're relaxed, they're just able to digest their food better. My favorite swaddle is the Mom Phone Call swaddle, because it's not like any other swaddle out there. Their technique is actually a Pilates move, so it helps open up that chest wall, helps them get nice deep breaths in, and just helps them get a lot longer stretch of sleep at night and get those better naps in during the day. If you don't have the Mom Phone Call swaddle, you can YouTube the Batwing trick with the Halo Sleep Sack swaddle, and that would be my second favorite. And then just one more tip for feeding with reflux babies. If you're doing formula, I like to do the Dr. Brown formula picture, because if we're doing formula and we shake the bottle up right before we feed them, and then all those air bubbles are there, and then they take that in instead of us, we don't have time just to wait and be patient and wait for them all. It's just like our Diet Coke. When we pour a Coke in, all those bubbles rise, and it takes some time for it to go down. So you can make a 24-hour batch of formula. It saves time, and it also helps them with their feedings. But those were my top 3 tips, is just following a schedule, the white noise machine, and a swaddle. So does anyone have questions about reflex?
Okay, great. Thanks, Emily. That was so helpful. I'm going to answer another question I got, which was to provide tips for flathead prevention. So now typically you hear about this a lot. For safe sleeping, the American Pediatric Association requires kids sleep on their back. So with that, we're seeing a higher prevalence of torticollis and flatheads. Torticollis is a significantly tight muscle on one side of the neck. So we want to counteract the back to sleep position while they're awake throughout the day. And my tips for that are alternating sides while breastfeeding or bottle feeding so that they're facing different directions. Changing their sleep position, which is not sleeping on the back, but actually changing the way the crib or the bassinet faces in the room. And that actually changes the environment that they're looking at so that they start to turn and rotate in different ways. Continue to perform tummy time at least 10 minutes twice a day. It doesn't have to be consecutively 10 minutes. It can be 1 minute at a time. And I always suggest, especially for the younger babies, to modify the position, meaning use your chest, roll up a blanket or a towel roll to put under their chest to help them be able to elevate and maintain the position for longer periods of time. I also suggest that you avoid bucket-like positions as often as possible throughout the day. That's the car seat. Those are your swings. So instead of placing them in those positions, try having them play on the floor or carrying them throughout the day. And I also want to emphasize that if your baby has a noticeably flat spot on their head, if they use one side of their body more than the other, if they have trouble rotating their head in both directions, or when you're holding your baby up, they're holding their head to one side more than the other, those are really good indications to see a clinician. And you don't have to see your primary care physician. Most states have direct access right now to physical therapy. In the state of Texas, you can see a physical therapist without a referral from a doctor. Your physical therapist will know how to screen for what's going on in your child and refer to the right healthcare provider if needed. So we can refer you to an orthotist if your child needs a helmet. We can refer you to a neurologist if we're seeing something else going on, or we can refer you back to your primary care physician. Okay. And then the last question I was asked about was an asymmetrical crawling pattern where one foot is up more than the other side. And typically when kids do this, it can be absolutely normal. It's fine to have one foot up. But what you want to see is if they're doing it with the right side, that they're also doing it with the left side. If you're seeing them get into a habit where they're only using one side over and over again, and that habit is repeating and repeating, and you're not seeing a shift in weight ever to the other side, then that's when you kind of want to step in and help your child make sure they can shift their weight and get their other foot up. Okay, there are a couple ways you can do that. So while they're crawling, you can give them a bottom shift. So if their right leg is up, you would shift their bottom towards that side that's up, and that way it shifts their weight over so they have to put their other leg up. Another way that you can work on symmetrical hip and bottom muscle development is having them play in kneeling positions and half kneeling where one foot is up at the furniture or at the wall. So I like to place toys on the edge of the couch and kind of put them on a position where they're on their knees, and then they can start pushing up and playing when they're on their knees. And that really helps with the bottom muscles and the thigh muscles, okay? And then the other position that really helps out with leg muscle development is performing sit to stands. So you can have your child sit in your lap, and again, you can face the couch and have them try to stand up from a sitting position to reach the toys that are on the couch. And you can kind of help them early on by lifting their bottom up initially, but the big thing is you want that forward push and that forward movement. You don't want them straightening up and pushing back into you. Okay, so those are my tips for helping with a more symmetrical crawl. And now I'm gonna throw it over to Emily for her questions.
Okay, so my first question I'm going to touch on is an overactive letdown. So that's when the breast milk comes out really fast and hard, and just like a minute or two into the nursing session. So the baby will be coughing, choking, pulling off the breast a lot. This normally just happens that first 4 to 6 weeks when you know your milk is coming in and they're still learning how to suck, swallow, breathe. So some tips to help with an overactive letdown would be, one, in the very beginning stage, the side lying position is great, because just like we were talking about for bottle feeding, it allows them to control the pace more easily. The same is with breastfeeding, and plus it's just position so important with breastfeeding for them to get a proper latch. So I would start off with the side lying, because that allows the milk to also dribble down the side of their mouth instead of them just being coughing and choking and kind of gagging. Another position that's great when they get a little bit older and they just have a little bit more neck control would be the laid back position. So you're just tummy to tummy with your baby, and this allows them to latch on to the breast by themselves and then also lift the head off when they need a break. So those two positions are great for overactive letdown. Another tip is you would hold, you know, the game rock, paper, scissors. So you make little scissors and you hold the areola, and you want to make ssure you're further back of the areola, because you do want the majority of the areola in the baby's mouth. But you're going to just kind of just use your little hand scissors and kind of just slow down the milk flow for the baby, so it's just not flooding their mouth. And another tip, my last tip for overactive letdown would be when you can kind of feel that tingling sensation. So when you know you're about to let down, just take the baby off and catch it in the haka. Haka is amazing. I highly recommend using that. So just catch it in the haka and then put the baby back on once your letdown happens. My next thing I'm going to talk about is starting baby food. That was another question that I had. So we recommend starting baby food anytime between 4 to 6 months of age. It's just something that you need to talk over with your pediatrician and see when will work best for your family and for your baby, because it also has a lot to do with different muscle development. But it's simply just a fun activity where it's to get them used to different tastes, different textures. I'll let them explore the world through food. We're not counting bites. We're not worrying about it. They're going to spit it out a lot. That's totally fine. It helps them get used to that sensation in their mouth and on their face. They still get 100% of their nutrition from breast milk or formula until age 1. So my most important tip for all families, no matter if you have introduced food to your baby, especially even with the toddlers, is you don't have to count bites. It's simply just to have fun, giggle, and relax. We just want to make it a special family time when we have meal time with our kids. I followed the Moms on Call introduction calendar with Harper. It takes you from stage 1 to stage 3 baby food in about 3 or 4 weeks, and it kind of gets you, it does all the work for you, so you don't have to remember, did I give this food or not, because you have to give a certain food every 3 days, just kind of keeping track of it. That way you can just track if they were to be allergic to any food. But that's what we followed. I loved it. It was very simple and easy to follow. And the next question I got was about swaddle guidelines and tips. So at 3 months, around 3 months old is when we recommend dropping the swaddle. So for healthy babies who are developmentally on track. So 3 months of age is a really sweet time because their little emerging personality starts, you get to see it, they're interacting more with you. So the 3 big transitions that happen around 3 months of age is they can tolerate a higher fever threshold of 101.5 instead of 100.4 because there's a massive gut maturation that happens at that age, and our immune system is mainly housed in our gut, so that allows them to tolerate slightly higher temps. But still always call your pediatrician if your mom gut is telling you that something isn't right. Second would be you can drop middle of the night feedings at 3 months of age for healthy babies who are gaining weight. Again, make sure you're following that Moms on Call schedule because that ensures that all those calories are getting met during the daytime hours so they can focus on sleeping effectively at night. And then third would be dropping the swaddle. Around 12 to 14 weeks of age, some families decide to drop the swaddle and drop the passy at the same time. That's totally up to you, whatever works best for your family. We want to drop the swaddle though at night first because we want them to first be comfortable with their own body management at night because naps are always harder because it's just such a shorter period. So once you drop it at night and then 1 to 2 weeks later, you can drop it for nap time. Make sure again that you have that white noise machine because that will help them sleep better. Then I was just going to go over into some parent self-care. Does anyone have any questions or do you have any input, Carolyn, about dropping the swaddle?
No, that sounds great. I mean, we always recommend that when they start rolling is the time to start working on dropping that swaddle. So I love your tips about dropping at night first. I think that's really, really helpful. Another swaddle that I like to use is the swaddle up. That really helps with bringing the hands to the mouth. So for more from a motor development standpoint, I've had a lot of success with that with some of my families. Go ahead, Emily.
Hannah, do you have a question?
Yeah, can I just say something real quick? I'm sorry, y'all. My daughter is 15 weeks. So, and I've always thought, okay, when she starts rolling over, I can stop swaddling her. But really this week I noticed those arms in that swaddle kept coming up. And I'm like, she just must be getting stronger because every swaddle that we've done, we use the Halo Sleep Sack. And then we have another swaddle that we use that we go back and forth if one's washing, but she's like breaking out of both of them. So I wonder if I should start, and she sleeps through the night. So I wonder if I should start unswaddling her at night.
Go ahead, Emily. Do you want to take it?
Well, I think it's good. We like doing it before that 4-month sleep regression because then you help them become comfortable with their own body management, and it also so it makes that you just cruise right through that. Okay. And also they start to get more mobile and strong at this age, and a sign, like a great sign, is like she's putting her hand in her mouth. That allows them to self-soothe. When we like dropping swaddles, we don't like to use a transition swaddle because then it's another transition you're just going to have to break later on again. Right. So might as well just get it all done at once. A Halo Sleep Sack is great to use like just a regular with their hands out. So that way they have access to their fingers. But it will be, she's sleeping through the night, but do expect a few rough nights when you do drop the swaddle because it does take them a little bit to get used to. I say about 3 to 5 nights. It normally takes them to get used to dropping that swaddle at night.
And start with dropping it at night, but keeping it during naps.
Yes, keeping it during naps, and then 1 to 2 weeks after you drop it at night, then you can drop it for naps.
Okay, yeah, that's interesting. We may start trying that because, I mean, those hands, she knows they exist.
And that's actually a really great thing, because that's how she is learning to soothe herself, and that's very important for development. So you want your baby to start pulling their hands to the middle, to start coming to the middle, because all of that really helps lower the stress hormones in the body. And it also teaches, it starts reprogramming the brain from kind of those asymmetrical positions to now being able to come to the middle, discovering their hands and starting different movements. So it is hard when you're trying to figure out the swaddle, but it's also those next natural steps, because she's going to be able to soothe herself now and won't need that tight wrap. And one other thing is that startle reflex is going to start to decrease. So she won't need that swaddle to prevent that big startle at night, which she had when she was a newborn.
Yeah. Well, thanks. Yeah, that's good advice.
Good. Emily, did you have any other questions? I know I did want you to touch on some of those caregiver tips that.
Yes, caregiver tips. And then I also forgot, I had that one about when to drop to 1 nap a day. And then I'll do the caregiver tips. Is that good?
That sounds perfect.
So when to drop to 1 nap a day, this happens between 12 to 15 months of age. So it's just going to be like 1 week of just where they, like, the naps are just, or, not good. And you kind of just got, a feeling that, okay, now it's time to do it. I did it at 12 months because my daughter at daycare, they were going to go down to 1 nap a day. And I just wanted that consistency at home and at daycare. So it was a hard, though, 1 to 2 weeks, I have to say. It was really hard, but so we kind of stayed home the first few days so she didn't fall asleep in the car or anything. And then we started that 1 nap a day at 12, and then as she got older, I kind of changed it to 12:30, and then I changed it to 1, just so then we had more time throughout the day to get errands and play dates done. But typically you'll drop to 1 nap a day between 12 to 15 months of age, and it's just, you'll just know because the naps are just going awful. And then, so we're going to talk about parent self-care. So one thing that I think is great, especially during this time when we're all just stuck at home and quarantined, is once babies are around 2 to 3 months of age and older, we like to have a bedtime between 7 and 8 p.m. And so what this does is it makes they'll sleep longer for you, and then it gives you and dad time to also have time in the evening to have some time together to watch a show or just hang out. When Harper was younger, once a week we would wait to eat dinner after we put her to bed. We would put her to bed at 7, and then we would have like a little date night at home with dinner at 8, and then watch a movie together. So just still making time, even though we can't actually get out on dates, we can make a priority at home once a week to do date nights. Another tip that I've had to do, I'm not a morning workout person, but just to help me feel better, I started getting up a little before Harper normally gets up. So at 6 a.m. she gets up at 7, and I started having my, just have quiet time, have time to drink coffee by yourself, and then I'll either go for a little walk or a run, and that has really helped me just start my day better, even though it's hard to get up earlier, but I feel so much better when I'm at home with the toddler the rest of the day. And then the last thing that's really helped me is, I always talk about it, but the Moms on Call schedule, because then she is a great napper. So during her naps, I get she's 4 and she takes 1 nap a day still. And that time is so important for me to now return work emails or just have a mental break for a little bit. So those are the top 3 tips that have really helped me when it comes to this new quarantine life and self-care. Do you have any extra tips?
No, that sounds so good, Emily. We're getting close to time here. So I just wanted to thank you again for helping me host this meeting, and thank all of y'all for joining us today. If you guys have any other questions on infant or child development, you can shoot me an email, and my information's on my website at www.boostbabiesaustin.com. You can also look up my Instagram or Facebook. It's @boostbabies. And Emily, why don't you share your information?
So you can find me on Instagram at infant basics and toddler training. I also offer mini consults for families who just have a couple questions. So if you have 3 questions, it's $30 through email, and you can go to my website or send me a DM and I can send you the link. I also offer another mini phone consult, so that's 15 minutes for $30. Or I'm offering 25% off all my personalized consults right now that come with 3 months of unlimited email support. So if you would want any more info about those, just send me a message. I'd be happy to send you over an email with all the info. And thank you so much for having me, Carolyn. I really appreciate it. It's been a lot of fun.
Oh, it has been fun. And thank you guys for joining us.
Thank you. Bye.
Bye.